Hi everybody, Dr. Britt Talley Daniel MD, a neurologist and headache doctor. I've written 2 books on migraine. One's the largest textbook, over 400 pages. The other one's a mini book, about 40 pages. And I have a big migraine blog at www.drmigraine.com. So today I'm posting up another YouTube video on a subject called Does GammaCore Treat Migraine? So migraine is a genetic condition that comes in families. It's inherited. They've already posted the gene for it, so it's considered now to be an inherited condition. It affects women about 20% of the time and men about 6% of the time. And for women, migraine is their most common chronic medical problem, more prevalent than high blood pressure, arthritis, or diabetes. It's a disabling condition. In medical school, they list the most painful medical conditions, and those are kidney stone, childbirth, and migraine headache. So many patients who have this will treat with over-the-counter drugs. And then, of course, triptans are good drugs for treatment of acute onset, but a lot of patients don't want to take medication for it, and they're looking for something else. Well, looking no more. Here it is. GammaCore is an electrical vagus nerve stimulator treatment for migraine. So the question is, does GammaCore treat migraine? Yes. The FDA has approved it for acute treatment of migraine headaches, saying it was, quote, safe and effective, period, end of quote. Some adults felt relief as quickly as 30 minutes, and almost half the patients had almost no pain within 2 hours. The majority of patients who were pain-free at 2 hours remained pain-free for 48 hours. Pretty cool, huh? The majority of patients who were pain-free at 2 hours remained pain-free for 48 hours. It's effective for patients who failed traditional oral or injectable medications such as triptans. And it avoids side effects of medication. So it's published on the other side of this, the triptan side of looking at treatment acute therapy for migraine. About 80% of patients respond to triptans. So the other side of that is about 20% of patients do not respond to a triptan. So this might be something good for them. So what are the side effects? Well, the most side effect occurs while using the device when it goes away after treatment. The most common thing was redness and discomfort where the stimulations are given. They're given the neck over the carotid artery, either the right or the left side. And sometimes you can have a dizziness, a little tingling feeling where the device is put on the neck. But it's been shown to be safe and effective across a range of migraine populations, both the United States and Europe. It has good clinical safety and quality of life outcome. So how does it work? Well, it's a vagus nerve stimulator. The vagus nerve is one of the largest nerves in what's called the parasympathetic nervous system. It comes from the medulla, it goes down the carotid artery and down into the bowel and stomach and the sexual organs. Everybody kind of knows about the vagus nerve. For instance, causes cells in the lining of the stomach to secrete acid to provide digestion. So that's an example of how it works. And the vagus nerve shuts off inflammation in the body. And migraine is an inflammatory condition. Vagus nerve stimulators are also used to treat depression and epilepsy. The vagus nerve has the longest course of the cranial nerves extending from the medulla to the abdomen. Its name comes from the Latin word vagare, means it wanders around. And so it goes to the stomach, upper and lower bowel, the bladder, and all the sexual organs. So this nerve stimulation produces a low voltage electrical signal, and the device is placed vertically below the chin. The stimulations are made until the patient gets a little contraction of the lower lip. That indicates it's working. That all goes away after you quit stimulating. Clinical results showed, as I've said before, good results in patients for treatment. So this is a short discussion of GammaCore for treatment of migraine. You might consider it for folks who failed triptans, want to try some alternative therapy. Good luck to all you patients out there who have migraine. God bless you, and stay tuned. I'll see you again.